it's because of the discovery of insulin that I'm able to do all of the things that I've been able to do in my life, from just walking outside with my dogs, to hanging out with my wife, to playing professional basketball overseas, or getting to interact with you guys in the diabetes community.
Because of insulin, for the last 31 years, I've lived a happy, healthy, and fulfilled life. My best accomplishment is this guy, being a mom.
Thanks, insulin. She's the best mom ever.
Because of the discovery of insulin, I was able to live out my dream and become the first WNBA player to play with type 1 diabetes.
I'm the father of 2 sons and 3 grandchildren. Without insulin being developed, that never would have been possible.
Because of the discovery of insulin, I can fuel my body with food that allows me to compete at the highest level.
Because of the discovery of insulin, I've been blessed to meet, see, support, learn, and grow with others living with diabetes.
Because of the invention of insulin, I can lead a life with no boundaries to do what I want and go where I want.
Because of the discovery of insulin, I can enjoy the beauty of Minnesota from my bike.
Hello, everyone, and welcome. Welcome to our Diabetes Awareness Month live stream event. I am Rob Howe. I'm a Medtronic spokesperson, and I have lived with diabetes for 17 years, and I'm currently wearing the MiniMed 770G system, and I am your host with the most insulin on board for today's event. So welcome. Thank you to all the Medtronic ambassadors who said what the discovery of insulin meant to them. 100 years ago in a laboratory in Canada, the discovery of insulin fundamentally changed how diabetes is treated. And this year, as we celebrated 100 years, it made me really think about how fortunate I am to be born at this point in history. Because of all the times I could have lived, the last 100 years are really the only time I could have lived and thrived with diabetes. And that is because of the discovery of insulin. From improved insulin formulas to glucose monitoring to automated insulin delivery, there have been many inventions over the last century that have fundamentally changed what it means to be diagnosed with diabetes. Medtronic has innovated and by creating technology and devices that are drastically improving how diabetes is managed. The means of delivering insulin have evolved from glass syringes to smart insulin pens, from pumps the size of backpacks to advanced hybrid closed-loop systems that fit on your hip. In the 1980s, MiniMed launched their first ever insulin pump. I'm sure some of you who are on this call today remember it. They also launched the first insulin pen in the 80s, and the first at-home blood glucose meter was launched. So even prior to the last 40 years, testing your blood sugar was something that has evolved significantly. In 1999, the FDA approved the first ever physician use continuous glucose monitoring system from Medtronic. In 2006, Medtronic launched the first CGM for professional use, and that same year launched the world's first sensor-augmented insulin pump. 10 years later, in 2016, Medtronic launched the first hybrid closed-loop system, the MiniMed 670G system, to automatically deliver background insulin. And today, it's important for me to also address the insulin access issues that many people living with diabetes face in the United States and abroad. And while we can celebrate, we must also continue to advocate for greater access to the insulin which keeps people with diabetes alive. This Diabetes Awareness Month, we celebrate not just 100 years of insulin and the technology advancements made since then, but also the incredible people who use insulin and their care partners, because we know it takes a village. Together, we are changing how insulin-dependent diabetes is managed. And because of these advancements, individuals like myself and people that you'll meet here today can not only live, but thrive with diabetes. Speaking of other people, I'd now like to invite my friend, Medtronic ambassador and fellow diabetes advocate, Kris Leeper, to join me here on screen. There's Kris.
Hey, Rob, thanks for having me.
Kris, excited to have you here, man.
Absolutely, yeah. Thank you for the time, and enjoy the conversation that we're going to have today.
Absolutely, man. We're going to talk today about what insulin and technology offer people like us. Because, we're talking about the last 100 years. And while 100 years is a long time, and I certainly hope that I get to know exactly how long that is, it has not been that long for people with diabetes like us to have the opportunities that we have today. So let's share some personal experiences on what we can do in our lives and some things that you have done because of the discovery of insulin.
Yeah, so recently, just coming out of Thanksgiving, I was able to really enjoy family and have good food and really fellowship and really not having type 1 diabetes take me out of that situation of just fun and being present. I was able to enjoy a lot of good food. Like, we're big foodies and we like to cook and eat. And so, yeah, I was able just to have, whatever I want, make sure I'm counting my carbs and just really being in the know of what my blood sugar is doing from day, minute to minute, day by day as we, go on this journey. But of course, for Thanksgiving, like just really thankful for having the knowledge and the expertise of what insulin is actually doing in my body as I live in real time.
I think it's so funny. And I think really apropos of this time of year. National Diabetes Awareness Month is November, and Thanksgiving. What a reminder as you're counting carbs on that table and dialing up that insulin of that we really do have a lot to be grateful for and a lot to be thankful for in our life with diabetes. And for you, I think we're talking a lot today about access and about some of the hurdles, but also the journey that we've gone on collectively as a diabetes community in terms of technology. Can you speak to like the evolution of technology since you've been diagnosed and since you've been living with diabetes and how that's improved your quality of life and allowed you to do some of the amazing things that you do?
Sure. Yeah, I was diagnosed in 2013. So it was really life-changing opportunity to walk into the ICU and be like, hey, you're type 1 diabetic and you'll need insulin for the rest of your life. And, here you go. And so when we look at, roughly less than 10 years ago of the technology, and like you were going through the journey, like things have changed really, really fast. And just the here and present time, things have been so like fast and loose and like, hey, type 1 diabetes does not mean a death sentence anymore. People are living long lives. You're able to make decisions on a daily basis to give you life every day. And that's what insulin and technology has done for me. And I know it's done the same thing as you as well. It's able to allow us to live the best version of ourselves as we learn and grow with the diagnosis. It's been a journey for me where I started with multiple daily injections without a CGM. And then going from that to where I am, 5, 6, 7 years ago, or till now is, hey, I'm actually wearing a CGM, I have a pump, and I am really thriving in day-to-day living with type 1 diabetes.
I love that. And for those of us who are on the call who were diagnosed prior to, to 2013 when you were diagnosed, for myself, it was 2005. I remember my doctors in my first treatment room, shout out to Children's Medical Center of Dallas. And they talked about, any dream that I had for my life would still be in reach as long as I took care of my diabetes. And they were talking back then, they're like, one day, today you're going to check your blood sugar on a meter and you're going to give yourself injections. But one day there's going to be technology that allows technology to monitor your blood sugar and give you insulin in real time and help you manage the burden of diabetes. And it is a burden. And I love that, we're here talking today about, 4 or 5 years ago when the first hybrid closed loop system, the Medtronic MiniMed 670G came out, and we're even pushing forward beyond that today. So it's very cool to be living in the times that people talked about and wished for back when I was diagnosed. So for those of us who are on the call today, we're going to be taking questions in the chat later. I'd love for you to add how many years you or someone you care about has lived with diabetes when you ask those questions. So I think that's something really to celebrate. And Kris, I think something that you and I have talked about multiple times is you started on multiple daily injections, and it wasn't until a few years into your life with diabetes that devices and technology like an insulin pump were even presented to you as a lifestyle option. What were those conversations when you finally learned about insulin pump therapy? Talk about the transition and what an impact that's had on your life.
Yeah, so left ICU with a vial of insulin, a pack of needles, and a prescription. And that's how I lived the first 4 years of my diagnosis. Looking back at it, I don't know how I made it through those 4 years with daily injections without a CGM and now the knowledge that I have today. I didn't really understand how to count carbs when I first left the hospital and ICU. I didn't really understand how carbs and exercise were affecting my blood sugar. So a lot of bad decisions were based off of my ignorance and misinformation from my healthcare team. And so looking back where I was then and to where I am now, like I know so much more, and that's because of technology. And having the discussion with technology has been life-changing to see how I can alter my daily activities with managing type 1 diabetes to make decisions easier for me. Just like a couple weeks ago, I just disconnected from CGM and my pump just for like 8 hours. And I constantly, my mind was racing about my blood sugar and what I was doing. And, I was still trying to be somewhat active, but I was like, oh no, like this is tough. Like it's hard to act like and think like a pancreas and make decisions that's best for you without the knowledge and the expertise that technology gives and allows today. And so I was very grateful to put back on my CGM and pump to go live my life as I normally live. And I couldn't imagine doing that for much longer than I did. And I don't know how I did for 4 years with just getting daily injections and not having the information like from my CGM and some of the knowledge that I started out with.
Man, that's powerful. And I think, when we talk about National Diabetes Awareness Month, it's so important that we talk about what the treatments that are available. And diabetes is not a one size fits all equation, and we're all very different. And being able to have access to technology that allows us to do the things that we do and live the life that is possible, that we want to live, is super, super important. And you really are living proof of, the mental burden that can be lifted, the lifestyle changes, and you can really live your best life with diabetes as long as you have the technology that fits your lifestyle.
Absolutely.
Well, Kris, man, when I think of people who are living with diabetes and really making it work for them, you're one of the first people I think of. I'm just glad that you're here with us today. We currently have a health equity montage video that we're going to show you. And when we come back, Kris and I will be back with Maribel from the Medtronic team. So I'll kick it to the video now.
I've developed type 1 diabetes, and it has been a struggle.
When I was diagnosed with type 1 diabetes, I will be completely honest with you, I was crushed.
Diabetes was basically killing me, being so heavy, I couldn't walk. I could barely walk anymore. It's been very painful to me.
I was misdiagnosed with type 2 diabetes. I'm actually living with type 1 diabetes.
The beginning of my diabetes journey involved in getting different recommendations from my doctors.
And my nutritionist at the time recommended that I eat fried chicken. Would you recommend that to every patient with diabetes?
I was having several low events that put me in the hospital. It was 8 years after my diagnosis of type 1 diabetes that I was told about an insulin pump.
I had to change my mindset, I had to change my thinking, and I had to get educated. And once I did that, then I became better at thriving with diabetes.
This pump saved my life. I wish I would have known sooner.
I received extraordinary support from Medtronic. Medtronic feels like family.
I can do the things I needed to do. It just makes me have a normal life.
Medtronic is working to engineer the extraordinary for people across all walks of life. While some are benefiting from diabetes technology, too many are not. Eliminating inequities in healthcare will require all of us. Join us.
Powerful video. And that, brings us to the reason that we are here today. We're talking about expanding access to diabetes technology because many people, as the video said, are not getting access to the treatments that they need. And sometimes that's just awareness, not even being told that these are available. So Medtronic is working to address health disparities for people living with diabetes. And today I'd like to welcome, there she is, Maribel Baker is the Director of Health Equity and Community Programs for Medtronic. And she's going to share a little bit about the work that Medtronic is doing. So let's give a warm welcome to Maribel. Thanks so much for joining us and welcome to the show.
Thank you, Rob. Hi.
Hello, hello. So I think, most of us here would really benefit from hearing what you and your team are working on and a little bit more about your role as the Director of Health Equity and Community Programs.
Yeah, thank you. Thank you for the opportunity. And like Rob mentioned, I lead this new team called Health Equity and Community Programs since earlier this year. And I want to tell you a little bit more about it, but also share with you the passion that I have for this. I've been working in the medical device industry for the last 15 years. And I believe in every single one of those roles that I've had, although different, they had one similarity. And it's that I've always had a passion for expanding access and enabling equity in care, either to the pediatric segment, to emerging markets outside of the US, or even to make sure that people have access regardless of their race and ethnicity. And so that back then, the term health equity wasn't as popular as it is today, but if you look at what we were trying to do and still trying to do is that we were bringing access to people, and the definition is very similar. What I came to realize as I look at the diabetes management is that there's so much information and data that is really showing the inequities that are just happening in front of our eyes. What we're seeing is that there's a problem with cost and affordability in the United States, people having access to medication, to the devices that they need to have a better quality of life, like Kris was mentioning, but even to live. And we need to work on that. And also we've been seeing in internal and even externally published analysis on the data that the rate in which people use diabetes technology is different based on the identity that they have in terms of the ethnicity and race. So what we're seeing is that for people that are identifying as Black and Hispanic, they're using diabetes technologies at 2 to 3 times less than their white counterpart. And when we look deeper into the analysis, we're showing that even though they are adjusting for socioeconomic factors, so having similar cost coverage, insurance, education levels, and income levels, the inequity is still there. So there's more that is happening. And it's like an eye-opening statement that there's actually more things that are happening than other than cost and affordability that are the reason why people are not on technology today. And so we're looking at what it is. It could be bias that may exist in the medical field, and not everybody that will benefit from these technologies are being informed of them or are given the options to be on them. We have lack of awareness and lack of education on the benefits of the technology, and then also the lack of trust on the recommendations from medical providers, but also trust in getting devices to manage their diabetes. And so Medtronic is taking a stand on this. We have a bold ambition to make a difference. We are increasing the representation of the patients that we're enrolling in our clinical studies, because it's really important for us to have clinical evidence of the people that have the condition. That really will help bring and expand access in places where we don't have access. And we need to make sure that we're creating marketing and educational materials with people that represent who has the condition. Imagine going to a website or going through a training and looking at the materials and you don't see one single person that looks like you. We want to make sure that we are being diverse, that we're representing people so that people resonate and say, I see other people thriving in this technology and they look like me and they are like me. So we also want to make sure that we have resources in other languages, that language is not a limitation for people to be on technology. And then finally, we want to educate providers, office, and clinical staff on the inequities that exist, and then what is their role in helping help make the change or drive the change. Because Rob, this is a complex problem. I think people have been trying to solve this for many, many years, and it really will take all of us to drive permanent and institutional change. And I think that's the message I want people to take, is that this is not easy, but if we all put ourselves together to work together to make this change, I think it could happen. And I encourage people to visit our website to learn more of what we're doing. It's medtronicdiabetes.com/health equity. And I think we're going to send that at the end as well.
Thank you, Maribel. I think, like you said, there's a lot of complex information, and there is, it's so important for us to distill that really concisely. So something I'd like to just say is that, Medtronic, it sounds like the research points to that you guys have done, that there are massive disparities between race and class about use and adoption of diabetes technology at a base level. And I know, Kris, you shared earlier about, it was not early in your diagnosis that you were presented with technology options like an insulin pump. And eventually you were able to overcome that and do your own research to get on insulin pump and CGM. And, I know as well from my own experience, it's a small sample size, that it was very different for me. My care team gave me the option of an insulin pump very early in my diabetes journey, and I had that awareness of that technology that was available. So Kris, can you share a little bit more about that experience and in terms of your conversations with your care team and, continuing to advocate for people with diabetes to have those conversations?
Yeah, absolutely. It was, 4 years, like I mentioned earlier, that I didn't even see what a pump was or how it could change my life. And so when I first started having the discussions about with a new doctor, new care team, of what a pump could do for me and my lifestyle, I was like, sure, why not? Let's try it. Like all the positives were, the information was very positive, very, very, very little negative feedback. So I was like, hey, this is a lot better than what I'm doing currently. So let's go for it. Let's go for it. And so when I submitted my insurance for, at the time, it was in 2017, so it was the MiniMed 670G plus CGM, my insurance denied it. And my insurance gave me, or opted for me, a 630G. So for me at the time, I was not offered the best solution for myself and the best level of care. It was like, here, the insurance is going to provide this, but that was only one step towards the ultimate goal of managing and living without fear with my diabetes. So, taking that's a gut punch, right? That's just a tough, conversation or situation to be in. So it was so welcoming to hear that Medtronic has other programs offering more access to allow you to afford, CGM and the latest and greatest pump. So the latest and greatest care for your body, and you can basically make decisions based off of the latest and greatest care. Because I was still supplementing, information and lack of details with just having a pump in general. So it was really tough at the very beginning. I know once my insurance didn't cover it, me and my wife put a plan together monthly to come up with the money to afford CGM coverage. But it didn't last very long because we quickly ran out of money. And we were still young and started, looking to buy a house and everything like that. So we chose other things than a CGM until Medtronic offered the access program to allow CGM covered at a really great rate. And really, I can afford it and be comfortable with it.
And Kris, man, you hit on so many, different, very relevant topics that people with diabetes face all the time. Is even when you have the awareness and even when you have the support of your care team, there are still hurdles that you have to overcome with insurance. And we're not always able to get the latest and greatest, for a variety of reasons. You mentioned these Medtronic support programs. Maribel, I'd love for you to speak to those and give us a little bit more information about the programs that Medtronic has brought to the table.
Yeah, no, thank you, Kris, for sharing that story. And I remember talking to you through all of those moments. And I just want to share that, Kris, you're not alone. And I've met so many people, and I've talked to several people living with diabetes, that just to understand their struggles and what we can help them with. And definitely on the coverage side, there is opportunities to help. And recently, a few weeks ago, I met somebody that has type 1 diabetes for 52 years. And it wasn't until his 50th year with diabetes that he went on an insulin pump. And for many of those years, he didn't even know that it existed. And when he did, it took him a year to get on it because he needed to navigate the coverage requirements of changing providers, trying to figure it out. So it's incredible that this still happens and that we're still sharing experiences like this. But we are trying to really work hard in creating different financial programs. We have several of them, and I don't want to list them all, but what I will tell you is that we will send you the link to the website that includes all the programs. And it includes things like having receiving supplies at a lower cost, like the access program that Kris just talked about for CGM when there's no coverage. It also has flexible payment plans from the pumps. But the best thing is probably to call our 1-800-646-4633 number. That they will be able to help you, because we know there's different situations, different scenarios. We want to make sure that we can help out with different programs, and that's why we created them. And so it's good to see that it helped you, Kris, and I hope it helps many other people.
Definitely. And thank you, Maribel. And just a reminder that we will be sending out some of these links in the chat, and we will also follow up via email with all the participants today and all the attendees with all the relevant links to the Medtronic programs. And I think, as we kind of transition into our next phase, I just want to encourage people who are watching that it is uncomfortable to talk about struggling and going into those programs. And I think that there's a stigma associated with asking for help that none of us caused, and we all kind of unknowingly know it's because it's very personal to talk about finances. And I would encourage people, if you have, if you've been weighing that option to call that number and just haven't done it, I'd encourage you to take that step and get started on those programs. So thank you, Maribel. This has been excellent, and I look forward to continuing to have these conversations about expanding access to diabetes technology with you and your team now and in the future. Thanks so much.
Thank you.
And we also know that expanding access doesn't just happen in a vacuum, and it doesn't just happen behind the scenes at Medtronic. It also is not just more individualized programs for those on pump therapy. It takes government affairs and advocacy work. And so I'd like to welcome Kael, the Director of Health Economics and Outcomes Research, to come share a bit with us about how Medtronic is advocating more broadly to influence policies and expand access for people with diabetes, not just at Medtronic, but behind the scenes.
Hi, Rob. It's great to see you. I'm happy to be part of this conversation today. So like you mentioned, to everyone else who's listening, my name is Kael Wherry, and I lead the Health Economic and Outcomes Research team here at Medtronic Diabetes. And our job really is to develop health economic and outcomes research evidence to maximize patient access to our therapies. So, we know at Medtronic that our job doesn't end in just creating and kind of launching these technologies. We, as a healthcare company, we have a role to play to ensure broad access to our products. And so I'm going to talk about a couple of the ways that we do that, Rob. First, I want to just share some of the analytic work that my team has done to kind of better understand gaps in access to diabetes technologies. So I'm going to share a little bit of data from a recent analysis that we did looking at Medicare beneficiaries that have type 1 diabetes. So here, I'll wait just a moment. Okay, so we're looking at a graph here, Rob, that shows, again, this is Medicare patients that have type 1 diabetes. And the graph shows the beneficiaries that are using either CGM or pump therapy between 2017 and 2019. And so kind of what this data tells us at sort of a macro level, we can see that the use of diabetes technology has increased over time, and that's great. But what also is pretty clear when we look at that is that that increase is really different for people of color than for white people. And so if we start at just 2017, we're going to dig a little bit deeper into the data here. If we look on the far left of the graph, we see about 4% of the people of color in this Medicare type 1 population were using either CGM or pump, compared to about 15% of white people in that same population in 2017. And so if we kind of follow the graph to the right, over time, we can see that the use of technology has grown to about 12 to 14% among the people of color. So that's about a 3 to 4 times increase. Again, that's great. But among white people, that rate has grown to 32%. And so that percentage point difference between white people and people of color has really grown, and that we kind of label this and describe that as an equity gap. And that's growing over time. And so one of the things, or one of the reasons we did this analysis in this population is because we know in the Medicare population, all of these people have access to the same therapy according to their insurance coverage. So this is a case where we see equal access to therapy, but the data make it really clear that this is not equitable access to therapy. And so when we kind of looked a little bit more kind of beyond just the numbers, when we looked at a little bit more about these patients, and we looked at kind of their demographic characteristics. If you go, you can go to the next slide for the next little bit, but we found that people of color were younger and more likely to have Medicare coverage because of disability or end-stage renal disease instead of age eligibility, kind of compared to their white counterparts. And this information is just important because it demonstrates kind of some of the complexity in the patient population. And again, it really underscores that equal access to therapy is not the same as equitable access. So for us, kind of some next steps on this, we're continuing to work on this study. We'd like to get it out in a publication to help inform providers and the public. We also plan to look at kind of similar data in different populations. Really, our goal is to continue, driving awareness of inequity in treatment for diabetes, but also we want to use this data so that we can contribute to solutions that will provide broad access to diabetes technologies.
And Maribel mentioned this earlier, but thank you for sharing that data. And I think, part of that is also continuing to get, people of color and, different diverse populations involved in research and involved in these clinical trials to continue to expand, equitable access, like you said. And it is good that the devices are increasing overall, but we have to make sure that we're addressing that equity gap in there as well.
Yep.
So for people today, like what actions can we take here on this call that, that would help continue to push that forward and, help expand access, and how can we use our voices?
So I can add here you can see 3 links where you can take some action. And I think that we need people to understand that. I get a lot of questions of why are we focusing on specific race and ethnicities? Why not everyone? And I think Kael's graph shows the why. It's great that we have TV commercials and that people are seeing more of these technologies on people, and that we're working on stigma so that people can show that they have diabetes and not be ashamed of it. But at the same time, if that awareness is equal for everybody, we see that there's still a gap. And this is why we are trying to be more intentional of the groups that really need that help to be able to get closer to parity to their white counterparts. And I love that graph because it really shows the gap that we're seeing in the increase for everybody, but not at the same rate, unfortunately. And so there's 3 links here on the screen. One is the Medtronic Diabetes Health Equity website. The second is the World Diabetes Day, how to get involved to increase access or help increase access. And then the Diabetes Patient Advocacy Coalition. You can access them and see how you can get involved locally as well.
And, for everybody listening, that World Diabetes Day is a petition. So really easy to log on there and petition to pledge your support for greater access to diabetes care by supporting that online petition. So really simple, easy way to get involved. And again, we will circulate those links so that we make it really easy for everyone to access the links that we're talking about. Kael, any other thoughts on the work that you and your government affairs and advocacy team are working on, and how that those of us here today can get involved?
Yeah, Rob, I just have one kind of last thing to talk about with respect to Medtronic's advocacy work. So Medtronic partners with the American Diabetes Association and ADA on their Health Equity Now initiative. And that is a comprehensive program. It addresses inequities in care for people with diabetes who come from diverse racial and ethnic backgrounds. So Medtronic sponsors a specific component to that program that's called the Technology Access Program, or the TAP. And that program really is intended to both identify and improve access to diabetes care among racial and ethnic patient groups who historically have been underutilizing or have experienced limited utilization for advanced diabetes therapies like CGMs and pumps.
Awesome. Thank you, Kael. And I see those links are being sent out to those for more information in the chat. So thank you, Suzanne, in the background there, and all of the support staff. We're going to shift gears a little bit and go to a Q&A portion. So I'm going to read out some questions that our attendees have submitted today. But first, I realized I did not give Kris Leeper a sign off. So thank you, Kris, for joining us today and for sharing your story. It's super impactful. It's always good to work with you, my dude. Okay, so let's go to the questions. So the first Q&A is, and this one I think, Maribel, you addressed earlier, so I'll send this one to you. Is Medtronic releasing devices in other languages to get more people on the technology?
Yes, so definitely we're working on that, and the Minimed 770G pump system does have access for the menu to be in Spanish and simplified Chinese, and the app is actually available in over 35 languages. So with that one, we have all the educational and training resources in those languages, and aside other languages like Arabic and Korean as well. We are, for our smart insulin pen, the InPen, and also for our Guardian Connect CGM, we do have access to all the training materials and cheat sheets in other languages as well, because what we want to do is not have that as an impediment for somebody to be on technology. Yet we want to make sure that it's safe for them and that they are able to take advantage of the benefits of technology.
Awesome. Thank you. I know that, seeing the device and diabetes device in your own language just makes a huge difference. I can't imagine having to rely on my translation skills to do that. So that's excellent. Question 2, and Kael, I think you already addressed this a bit earlier, but how is Medtronic working with the ADA and other advocacy groups that are also prioritizing work on expanding diabetes access?
Yeah, I guess I would just reiterate again that we're partnering with the ADA and their Health Equity Now initiative, specifically through that TAP program that looks to improve access.
Yeah, and I wanted to add, if I can, sorry, that there's other industry members that are also part of TAP. So this is where I was trying to say, this is not only Medtronic trying to solve this problem. We need to all come together to be able to solve the problem, because it is complex. And that's why we know other medical devices manufacturers are working on this as well. We need to use the extent and power that we have to be able to make a difference. But I wanted to add as well, JDRF is also putting a lot of focus on this. And they recently had their first Type 1 summit in Spanish, all 100% in Spanish. Actually, everybody that was supporting it had to speak Spanish to be able to address questions. And so I think that's a great first step, right? To be able to, there was a lot of people that we talked to that had never known about technology before. And they've been living with diabetes for many years. And we were doing that in Spanish. And I felt like, okay, we're giving back. We're definitely like giving this access to people that aren't able to have those conversations before.
That's excellent. Another question, and I think this one can be for both of you. How is Medtronic working to raise awareness about health inequity and the disparities of diabetes care and devices with doctors and HCPs?
You go first, Kael.
Okay, sure. Thanks, Maribel. So one example, Rob, is, when we looked at the data together, that's an example where our next step, we'd like to get that into a peer-reviewed publication where we put hopefully a clinical journal, so that goes right into the hands of clinicians who can read about it and make decisions based on it. And that's one analysis that we're doing. We have several others that we'd like to, this isn't just a one and done. We want to continue doing that type of work and getting it out into the peer-reviewed space so that clinicians can see it.
Yeah, definitely. I think the physicians, they read a lot of publications, and we need to increase that awareness on the data and side as well. But we also train thousands of providers, office, clinical staff every year. And so one of the things that we have done, thanks to that professional affairs and clinical education team, is including all the slides that talk about the data summary of the inequities that we're seeing, and really provoke the question of what their role is. How can we tackle unconscious bias? And how can we identify it and really commit to making changes? Because to this person's question, the doctors do have the key to help with this, right? But they're not the only mechanism. I think that that's one, and we are definitely educating and creating awareness, but we have to also do it from the person living with diabetes perspective as well, because I think that awareness needs to go, and it has to be beyond social media. So how do we go into the ground and foot on the ground and really go through the communities to get to the right people that really need it, that might not be in social media?
Yeah, I think about that a lot, as somebody who's very involved in diabetes social media, is that not every person who's living with diabetes is on social media. And even the ones that are not all interested in diabetes content and, in participating in diabetes communities. So reaching those people where, they are most available and, most likely to receive that message is super, super important. Okay, well, that concludes the question portion. I think this is the time that if we have any closing comments from any of our panelists. I know, for me, it's been my pleasure to be here, and it's been awesome to talk about all of the issues facing people with diabetes, because we all know that diabetes is a disease with so many inputs, and it does not look the same from one person to another, either with treatment or device preferences or with access or with anything like that. So it's so important to address the individual needs of people with diabetes as we celebrate National Diabetes Awareness Month in 2021.
Thank you, everyone.
Yeah, thank you guys. And thank you for following along. We will send that email recap. Thank you so much for your questions. Thanks to Medtronic and thanks to all of our team members and panelists here today who put this on, and also to all the below the line folks who are behind the scenes, answering comments, moderating, help put on, production of this. Thank all of you guys, and happy National Diabetes Awareness Month. I hope you guys are enjoying leftovers from a great Thanksgiving, and we will see you next time.